Hi everyone, my name is Emma Robinson, and today I'm going to be going over the Potential Program Recovery and Resilience Initiative, which would be a substance abuse recovery program that would take place in Henderson County. So the target population for this program would be adults aged 20 to 50 in Henderson County that are impacted by substance use disorders, or SUDs. Specifically, the focus would be on those who are low income or have limited behavioral health access, as well as underserved populations. Some common barriers for these groups are stigma around just substance abuse in general, as well as seeking help, and then limited transportation, as well as housing instability. Some of the leading health indicators that are provided by the Healthy People 2030 for substance abuse are to reduce drug overdose deaths, increase access to substance treatment, and reduce serious psychological distress. And the Recovery and Resilience Program, or the RRI, promotes recovery, education, peer support, and community resilience, so it would help aid those Healthy People 2030 goals. So the current data for North Carolina and also Henderson County, you can see that this is an issue that needs to be addressed. In North Carolina, for overdose deaths, there are 4,200 more annually. And in Henderson County specifically, there are 62 fentanyl-related overdoses in 2023. And as someone who lives in Henderson County, I can say that substance abuse and drug use has always been an issue, but in recent years, fentanyl has been kind of the main offender. So there's also limited outpatient recovery programs outside of urban centers, so this just shows the clear need for recovery services. The program overview, so the mission of Resilience and Recovery Initiative would be to strengthen recovery, resilience, and reintegration for adults affected by substance use through community-based education, peer support, and mental health resources. And the vision for the program is a healthier, more resilient Henderson County where every resident in recovery can rebuild their life with dignity and purpose. Some of the goals and objectives of the program in order to reach that mission and that vision are to reduce relapse and incarceration by 20% within 2 years, to increase community program participation by 30%, and to improve coping skills and self-efficacy. The objectives are the process to launch 5 weekly support groups in the first year. Learning, 75% can identify consequences of substance use within 12 months. And behavioral, 60% maintain sobriety for more than 6 months by year 2. And all of these would help to reach those Healthy People 2030 goals as well. So some of the ways that we will do this with some interventions would be, again, the weekly recovery support groups with the trained peer facilitators. So we would have to have some trained facilitators there since substance abuse and substance use is not a common experience. It can be hard to relate to these people on a level where they feel that they're being seen and heard. So having people who are trained specifically on how to deal with those situations, the emotions that come with that, is important to make it effective. Educational workshops on coping skills, relapse prevention, and community reentry. Again, if you have never experienced this yourself, it could be hard to understand, and it would be hard to know what exactly to teach, what coping skills they would need, and then how to prevent relapse as well. So just having someone trained on all those topics would make the program more effective. So there will also be partnerships with Blue Ridge Health, local faith organizations, and Henderson County EMS for holistic care. Blue Ridge Health is our local healthcare system. They serve low-income and underserved communities, those without insurance, things like that. And so they're a great resource for getting healthcare. And then local faith organizations like churches and things like that, they can help donate items, provide spaces to meet, maybe even sponsor participants. And then Henderson County EMS is just kind of for the protection of the participants. Since there has been some substance use or substance abuse, there could be more opportunity for some health effects, and so it's just good to be prepared for that. Resource navigation for housing, employment, and counseling. So this will just help them with that re-entry. So help them get housing, help them get employed, and get the counseling that they need to be effective members of society once again. So for the behavior change theory, I would like to use the social cognitive theory. It focuses on self-efficacy, observational learning, and reinforcement, as well as using peer mentors model recovery behaviors. And so it helps to set achievable goals and track progress. And by doing that, you have positive reinforcement to foster long-term behavior change. So if they feel encouraged, if they feel like they're making progress, they'll be more likely to keep doing these behaviors that they have learned. And having model recovery behaviors as well will help do that, giving them an example of someone that they can follow, and focusing on self-efficacy where they have the support of others, but they don't need it to be successful, all will help with that long-term behavior change. So the resources needed, since this is a very specific program, it has some very specific needs, and just due to substance use in general, it can be costly. And you do need some trained facilitators. So for personnel, you would need a program coordinator, peer mentors, and licensed counselors, just to make sure that you are meeting those people's needs and actually giving them effective and accurate information to help them move forward. Community partners, the Henderson County Health Department is a big one to endorse this and encourage people to attend, give it some credibility. Blue Ridge Health, again, to provide them with healthcare services. Open Arms, local churches, all of these can kind of come together and help with supporting these individuals as they move into recovery. Funding, so funding would rely on county health grants, community foundations, and volunteer contributions, as well as donor contributions. So this program would be costly. There would be no money coming in since it is a free service, so it would rely on donations and grants. And so a goal in the future would be to definitely have that long-term sustained funding, and as it grows and we get more data and we see the benefits of the program, that would be more sustainable. Materials as well, educational handouts, online resources, workshop kits, all of these would help to kind of solidify information, help it be more memorable, and would give them something to leave with that they can work on throughout the week. So the benefits of this program, there are many, but here are some. So this top line is for the individual and the bottom is for the community. So for the individual, improve coping and relapse prevention skills, access to stable social support networks, enhance mental health and life satisfaction, and decrease risk of reoffending and homelessness, which are all for somebody who is experiencing homelessness, is struggling with substance abuse, maybe is unemployed. Those are all huge. For the community, it will reduce substance-related crime and emergency service demand, so it will kind of reduce that strain on the community, as well as stronger community cohesion and resilience if we come around these people who are struggling, instead of kind of rejecting them because of a stigma around what they're doing. It will just create a stronger community to where we can encourage one another and help one another. Improve local workforce participation. There will be more jobs filled. The job retention rate will go up if these people are able to have functioning lives. And it will also lower healthcare costs associated with substance misuse. So obviously, like we said before, there are some health implications that come with abusing substances, and so that would reduce that as well. So some ways to get involved: fund community recovery events, as well as just fund the program in general. Like we said before, this program does rely on donations and grants to keep going forward. You can volunteer as a mentor or educator if you have those credentials. Because this is a nonprofit and because it is a free service, we will not have a full-time staff that is always on hand, so it will rely on volunteers to help these people and support them, and that also will help fulfill that goal of bringing the community together. Providing meeting spaces or supplies, if you have somewhere that we could meet for free, or supplies that you think would be beneficial to helping these people towards recovery. Advocate for local policy support, again, getting those grants in place, getting resources for us to be able to help these individuals, and then sharing success stories to raise awareness. Obviously, one of the ways to promote this program is to spread it by word of mouth. And if you know somebody who could benefit from something like this, sharing success stories would make them more likely to join, encourage them more, and it also just raises awareness for those in the community who may also be able to support. So the evaluation plan, how we're going to see if this is actually effective. Some quantitative data will be to track attendance, relapse rates, and employment outcomes. Obviously, we hope attendance is high, relapse is low, and employment is a guarantee. That would be the goal, but we will track that and see how effective this program is on those outcomes. Qualitative data would just be participant feedback, interviews, and self-efficacy scales, seeing what the participants are saying, if they feel like they're being successful or if they feel like they have seen change in their lives. And so in order to do that, we will track this data 6 months and 12 months evaluation checkpoints to see if there has been any growth. Some limitations of this program, because there are always some, are limited long-term funding. Again, this is a big issue for in the future, so that's why we need to get support and funding now. Volunteer burnout risk. Since we are small and we have a small budget, we're relying on volunteers, and because of this group of people, it can be frustrating or discouraging to work with someone who, is continually harming themselves or making poor choices, so that can be an issue as well. Transportation barriers in rural areas. In the city, we have a bus system, but in those rural areas, it can be hard to get to and from places. And then also just persistent stigma around seeking help and also around helping these people. But luckily, all of these limitations can be overcome. So future directions of the program would be to expand services to neighboring counties. Substance abuse and misuse is not something that's limited to Henderson County. It affects all counties, and so it would be a great program to have in place everywhere. Develop mobile outreach and tele-recovery options, so this would help with that transportation limitation because you could go to people, they wouldn't have to come to you, and also tele-recovery would help if they're not able to make it to services, if they don't have time or money or resources to get there, they could just do some type of online call or something like that to give them the same support. Secure long-term sustainability funding through county partnerships and grants and donations. So this is, like we said, a big one to make sure that the program grows. We have to get that long-term funding, which some of it will come through data and showing the benefit of the program, and some of it will just be hopefully securing some donors and some stakeholders. So in conclusion, one death from substance abuse is too many, and we've already seen that we have more than one. And Recovery and Resilience Initiative unites individuals, families, and communities towards lasting and healing change. And it brings community strength, unity, and resilience. Overall, this is a great program to invest your time, your money, or your resources into. You'll be able to make lasting change. You'll affect not just one person, but families, children, spouses, and you'll help these individuals to get their life back. So it is a great cause. These are my resources for the program and for the presentation. Thank you very much.